Today, I want to discuss the ways vaccines can be administered and sort of the pluses and minuses of different ways. This is kind of in response to the fact that there was an article that described a scientific experiment where vaccines were delivered or manufactured in beer using brewer's yeast, and that got some headlines. I was quoted in at least one article about this, and that got me thinking maybe people really want to know about different ways to give a vaccine. So the most common way that vaccines are given is through an intramuscular injection, often in the deltoid muscle, sometimes in the gluteus maximus. And that's the most common way. That's a highly vascular area. The, the vaccine is uptake very quickly by immune cells and traffic to lymph nodes. Another place that you can get a vaccine is subcutaneously, which would be just under the skin, not quite in a muscle. So that's another type of way that you can get a vaccine, again, involving an injection. So flu vaccines usually given intramuscularly, COVID vaccines intramuscularly. There were flu vaccines that could be administered subcutaneously, and the advantage of doing it subcutaneously is there's a lot of immune cells underneath your skin, and you could lower the dose, which would mean you could stretch your vaccine supply. So those are the two main ways that vaccines are given. A third way is intranasally. So there is an influenza vaccine that is part of a nasal spray. It's called Flu Mist. It's now available basically by mail order. You can fill out something and they send it to you. And this is an easy way to give a vaccine. And it's the only nasal vaccine that we have. So this is kind of an advance because when you think about vaccines and giving a vaccine or turning a vaccine into a vaccination, there's logistics involved. And if you can administer something that doesn't involve an injection, meaning someone has to be a somewhat trained professional, they've got to swab the skin with alcohol or whatever and inject the vaccine into the subcutaneous tissue or into the muscle, that's an easier thing to do if you don't have to do that because number one, you need a healthcare professional, you need needles, you need supplies, you need to be able to dispose of the sharps. All of that adds cost and adds logistical issues. So a nasal vaccine, one that can be mailed to you, has major advantages in terms of ease of administration. And that's not even to mention the needle phobia issue, that there are many people who won't get a vaccine because they're afraid of needles. So using non-injection alternatives makes a lot of sense. So we talked about injections, we talked about nasal. Another way is to give a vaccine orally. The most common vaccine given orally is oral polio vaccine. That was the Sabin vaccine. And that was used for some time in the United States, and it is still used worldwide. And in that situation, they basically drip the vaccine onto a sugar cube, they put that in someone's mouth, and the vaccine is delivered that way. And there's advantages to doing that, not just because of the fact that it's needle free and anybody can do it, but the polio vaccine works in a specific way if it's given orally in a way that it's not so when you give it injection. So the oral polio vaccine has a role. There are other vaccines that are given orally, like the cholera vaccine, the typhoid vaccine. There's an injectable version and an oral version. There's adenovirus vaccines, which are not given to the general public, but are given to the US military. Those are also given in oral format. And that is kind of where this beer vaccine would fit. It would be an oral vaccine. Obviously, there's some issues. This isn't quite ready for prime time. This is more proof of concept. They don't really have data yet on a lot of people, but this is another way to give something orally. There had been talk of putting vaccines or engineering vaccines into potatoes that people could eat as well. That would have been something that would have made it easier to give vaccines. And I think there'll still continue to be innovation in oral vaccines. And one of the things about giving a vaccine orally or giving it through the nose is it induces different types of immunity. I kind of alluded to that with the polio vaccine. But if you can get immunity at the site of infection for a gastrointestinal virus like polio, or in the nose like influenza or even COVID, maybe that gives you a more durable vaccine, one that's better at protecting against infection versus an injectable vaccine. There's also work to make vaccines to deliver them through the skin, basically through a patch. So there's been efforts to develop vaccines and vaccine technologies that can kind of be given through micro needles in a patch. Again, very easy to administer. You can mail that to somebody. They could put a patch on and get vaccinated. And we use patches for contraception. We use patches for pain medication. We use patches for nicotine. So that is an effective way to deliver a drug. But the point is, we need multiple different ways for multiple different vaccines, and it might not be one size fits all. In fact, it's probably not going to be one size fits all. Certain vaccines may be better given in certain ways. But having these options, especially when you have that technology built out, like a platform for oral vaccines or a platform for patch vaccines or a platform for nasal vaccines or even mail order vaccines like FluMist, that's really important for an emergency when you want to distribute vaccine. And if people can give this vaccine to themselves because it's something that they drink or eat or swallow or something that they slap on their skin or something they squirt up their nose, that's easier than a vaccine that you have to inject into somebody. So this type of technology has implications not just for routine vaccination, but for emergency and pandemic vaccines. And while I don't know that we're going to see vaccines in beer, and probably the anti-vaccine groups will object to having vaccine in beers, and maybe the beer companies won't want their product associated with vaccines. I think the fact that there are articles about a novel way to deliver an oral vaccine is a good thing. And hopefully, this technology continues to mature and we do get more ways to give people vaccines.